From the nation's capital, the Conservative Caucus presents Conservative Roundtable, an in-depth look at today's most important issues.
Welcome to Conservative Roundtable. I'm Howard Phillips, chairman of the Conservative Caucus, which sponsors these broadcasts, now being shown from coast to coast and on YouTube. One of the hottest topics facing Congress and the country this year is socialized medicine. And we're honored to have as our guest Dr. John Goodman, who is the president and chief executive officer of the National Center for Policy Analysis. I don't think there's anyone in the country more knowledgeable on these issues than Dr. Goodman. He played a key and decisive role in blocking Hillary Care back in 1993. And right now he's on top of all the problems which we would face if Mr. Obama got his way on socialized medicine. What does Obama have in store for us? What is he looking to do?
Well, Howard, it's going to be very, very bad. We start with the best healthcare system in the whole world, and it's really under threat. And by the time they get through with it, I'm afraid that it will be a mediocre healthcare system, and it will affect every one of us. We won't have access to the high-quality care that we've become used to.
Well, if Obama has his way, as I understand it, people will lose at least some of their ability to determine by whom they will be served, at what cost they will be served, whether they will be served, where they will be served, et cetera, et cetera. And things looked pretty bad when Bill and Hillary were in charge. Why is this a more difficult situation? Because you had a lot to do with killing their scheme.
Yes, well, in some ways, Obama is much more popular than Bill and Hillary Clinton were. And his goal is to nationalize the entire healthcare system. And if he gets his way, the federal government will tell every employer and every worker and every citizen what kind of health insurance you have to have. And eventually, I'm afraid that the vast majority of people will be over in a government-run plan. The Lewin Group in Washington estimates that up to 120 million people will lose their private insurance, and they will be in a government-run plan. And I'm afraid in that government-run plan, they will have their health care rationed.
And they're talking about taxing businesses even more than they're now taxed for their health care plans for their employees.
Right. They're going to tell every employer that the employer has to provide health insurance, and they're going to tell the employer what kind of insurance they have to provide. And if they don't do it, they will be taxed.
Now, is Obama going to be able to push this in one fell swoop? Who are the main advocates in Congress? Is it Max Baucus of Montana who is guiding this effort? And, of course, Daschle would be guiding it had he not been forced to withdraw. Right.
Baucus is in charge. I'm not hopeful about what's happening in Congress or in Washington because all the special interests have caved. Now, the drug companies, the Chamber of Commerce, the insurance companies, they're all in Washington right now negotiating the terms of their surrender.
Why?
That's hard to answer. You get momentum, they think it's inevitable, so they're in there saying we want to cooperate, we want to be part of the effort. The same thing happened 15 years ago. Exactly the same thing happened with Hillary Clinton. All the special interests were ready to deal with her, and she was stopped, not in Washington. She was stopped back by the grassroots effort back out in the hinterland.
Why can't we do that again?
I hope we can. And I think we're going to have to try because it's not going to be stopped in Washington.
Who are our best friends in the Senate and the House in fighting these schemes?
Well, unfortunately, the Republican Party is in disarray on a lot of issues, but especially on health care. They are simply not together, and they're not going to get together. There is a bill that I like. It has been introduced by Senator Coburn, Tom Coburn of Oklahoma, and I've helped him, and it's been endorsed over on the House side. A lot of people are calling it the Republican plan, but I think you will see most Republicans will not endorse it. So it's very hard for Republicans to get together.
Tell us about that plan. What's good about it?
Well, what I like about it is it takes all of the tax subsidies that we now have for health insurance, which are arbitrary and unfair, and it just divides them up and gives every American the same subsidy. So a family of four would get $5,800 for health insurance, and every family gets the same number of dollars, and that's fair, and the tax subsidy subsidizes the core insurance that we want everybody to have, and then if people want extra insurance, they buy that with after-tax, unsubsidized dollars.
And do you believe that Obama is going to push his whole scheme at once, or will his approach be incremental?
Well, their biggest problem is getting the bill, and if it falls apart, it will be because Democrats can't agree with each other, not because of anything Republicans are going to do. And the biggest issue of contention is the idea of a public plan. And what that means is that everybody who doesn't get insurance from an employer will go into an artificial market completely controlled and regulated by the government. And they'll be able to choose a Blue Cross plan or an Aetna plan or a United Health plan. But the left wing of the Democratic Party wants one of the choices to be a government-run plan, which in their mind is Medicare for young people. And they think this Medicare for young people will pay very low rates to doctors and hospitals. Therefore, its premiums will be lower. And that's why everybody will eventually be in this government-run plan. And that, after all, is what they wanted all along. They like the Canadian system. And so this is their way of getting to the Canadian system.
Isn't it ironic that people in Canada and the United Kingdom go elsewhere when they've got serious health problems because their health systems are disastrous?
Well, that's right. There's rationing, there's waiting. In Britain, they go elsewhere within the country. They can go to the private sector. Canada has just outlawed the private sector, so Canadians come to the United States for care they can't get in Canada.
Now, Free Our Health Care Now. Is that your petition that you're promoting?
Yes, the site is freeourhealthcarenow.com. And you go to that site and you can sign a petition which says you want the right to choose your own doctor, you want the right to private health insurance. Basically, it's just a few simple principles that are straightforward. Doesn't mention Barack Obama, doesn't mention any bill in Congress. But it allows people to express their commitment to a free enterprise, private approach to health care.
Is there any significant element of the private sector on which we can rely for help in defeating the Obama scheme?
Not really. When I was listing all the special interests that were selling out, I may have neglected to mention the American Medical Association.
Of course, they sold out years ago.
Yes, the Hospital Association. Just every large organization in healthcare is in Washington negotiating with the enemy, actually.
They feel it's inevitable. I remember visiting Moscow years ago and asking Richard Coombs, the chief of mission there under the ambassador, why Dr. Kissinger was always pushing to make concessions to the Soviet Union. And Coombs said to me, well, he's of the view that the correlation of forces is more favorable to the United States now than it ever will be again, so we've got to cut the best deal we can now. And that's what these folks are saying, that it's inevitable that Obama's going to prevail, and we've got to cut a deal with him.
That's exactly right. But, of course, the one group that isn't there cutting the deal is Grassroots America.
Well, Grassroots America killed Amnesty for Illegal Aliens.
Yes.
Had a lot to do with killing Hillary Care.
Yes.
And but we need to sound the tocsin. They need to know that the crisis is coming. Now, are you going to be Paul Revere in doing this?
We're going to try. We have a plan. We're trying to enlist all the major talk show hosts. And, you know, there are 4,500 talk show hosts in the United States.
Wow.
About 90 or 95% are right of center, and we hope that they will get very engaged on this issue. We plan to go to websites where conservatives tend to go on the Internet and post ads for our petition. And so we've got a long list of things that we want to do, but ultimately it'll depend on people responding and resisting.
What's the timing? How much time do we have?
Oh, we don't have much time. The Obama forces would like to have a bill before the August recess so that all the members of Congress can go home and brag about what a great job they've done. But that's when they need to hear from voters.
A bill, but not a bill enacted, just a bill proposed.
Yes, a bill on the floor that they can talk about.
Well, that gives us a target to shoot at.
Oh, absolutely. But it's a short time frame. And the other side is extremely well organized. I'm told they have 1,600 doctors ready right now to go on the radio and talk about why we need this health care reform. They have their own grassroots organizations they're forming. I've told they have $84 million they're ready to spend, so they have enormous resources and they're very well organized.
How is your work supported?
Inadequately.
I'm sure that's true. But do you have any major donors, or is it grassroots funding? Or
well,
what?
no, we get half our money from foundations. We go to corporations, individuals, but it's spread around. We don't have one person or one entity that provides most of our funding. So we go knock on doors like most nonprofits in the United States.
Well, I hope that many of those doors are open to you. Dr. Goodman, we're going to have to take a break here. We'll be back after these messages with Dr. John Goodman, the head of the National Center for Policy Analysis, who is probably the most knowledgeable man on our side in this country about the threat to our personal control of our personal health care. Please stay with us and you'll learn more. There are many conservative organizations, but the Conservative Caucus is unique in that our standard for evaluating public policy is the Constitution of the United States. Our goal is to advocate policies which conform to what the Constitution stipulates and to oppose those which undermine the Constitution. It's clear that the federal government has only those powers which are provided in the Constitution, which were initially delegated by the states to the federal government or which were subsequently added by amendment. If we adhered to that principle, your taxes would be lower and your liberties would be more secure.
The Conservative Caucus, www.conservativeusa.org or 703-938-9626.
Here's how you can become a citizen lobbyist and influence how your representatives vote. Write a letter to your congressmen and senators. Speak out on a call-in talk radio program. Write a letter to the editor of your local newspaper and call the Conservative Caucus for more information at 703-938-9626.
I'm Howard Phillips, chairman of the Conservative Caucus, back with Dr. John Goodman, chief executive officer of the National Center for Policy Analysis. And one of the things we haven't discussed, John, is the key role you played in developing the concept of health savings accounts. Talk about those and what they do.
Well, that's very important. The idea is that people should be able to control more of their own health care dollars. When you control your own dollars, you're making your own spending decisions. The doctor tends to look at you as his client instead of looking to Blue Cross or Medicare or some other third-party payer. So they empower patients. And when you empower patients, doctors become agents of patients. That's the idea.
How did you become involved in the whole concept of medical care, health insurance, the way it ought to be? What sparked your interest, and how did you become involved?
Well, it was almost by accident. I was teaching at Dartmouth. I had a fiance in Dallas, and I decided in the spring to move to Dallas. I didn't have a job, and a couple of institutes asked me to do some things, and one asked me to write a book about healthcare in Great Britain. So I did, and I got very interested in the topic. And then the Cato Institute asked me to write a book about the history of the regulation of medical care. And the more I looked into the field, the more I realized that this healthcare has never really ever been a free market, at least not in the last 100 years. And doctors are as much at fault as anybody else in getting the government involved and suppressing normal market forces. So here we are today, and our biggest problem in healthcare is it doesn't act like a real market. And the normal competition on price and quality that you see other places, you just don't see in healthcare.
And why is that?
Because we have suppressed the market, and we have gone to great lengths to keep doctors from through the years from competing like ordinary professionals, of preventing insurance companies from acting like real insurance companies, and just every part of the market has been influenced by government.
You made an important point. There used to be a doctor-patient relationship in which there was no or only very limited bureaucratic and governmental interference. But it's very hard for that kind of relationship to be maintained today.
It is indeed, because the third parties interfere, and one of the things the Obama forces want to do is interfere even more. And Tom Daschle wrote a whole book about this, and he said we ought to be doing what they're doing in Britain, where they have an agency that does cost-effectiveness research.
And one of their conclusions is that if you're too old, it's not cost-effective for the government to give you the care that you may require.
That's right. And sort of the rule of thumb is if a drug costs more than $35,000 to prolong your life for a year, that's too much. And so in Britain, patients are routinely denied access to cancer drugs that are very common in Europe and the United States. That's the great fear, that with health care reform, we will get a lot of intervention in the doctor-patient relationship, and eventually we'll just be denied access to care.
There are more and more doctors, or at least in my acquaintance, who refuse to accept anything but cash for their services. They will not take Medicare.
It's a growing phenomena. Still not a whole lot of them, but their numbers are growing, and they're very interesting to me because you see the traditional doctor, because he's so constrained by the insurance companies, typically won't talk to you on the telephone, doesn't email you, doesn't keep your records electronically. But these so-called concierge doctors who won't deal with the insurance company, they talk to you by phone, by email, they keep your records electronically. They sit down and advise you on how to negotiate the healthcare system. That's what a doctor ought to be doing.
You know, one of the things we haven't talked about is the degree to which our privacy will be invaded under the Obama scheme. Our medical records will be in the public domain.
Well, or at least the government will have access to them. And what we've discovered is it doesn't matter how many privacy statutes there are when you get these things electronic. There is a great risk that people get access to them.
How widely are the health saving accounts being used today?
Well, 12 million people are managing some of their health care dollars in these accounts. About half of them are called health savings accounts. The other half are called health reimbursement arrangements, which is pretty much the same idea. And it's the fastest growing product in the health insurance marketplace. People like to control their health care dollars.
In terms of timing, you indicated that Obama hopes to have a bill up for consideration before the August 7 recess. And if that happens, what are the chances for slicing and dicing that legislation and forcing Obama and his allies to deal with elements of it one piece at a time?
Well, their biggest problem is this public plan, because if there is a public plan, a sort of Medicare for young people, then I think the insurance companies will bolt. I think the doctors will bolt, and the hospitals. And so then you peel off major special interest groups who say, we're not going to go for that, because that means that their patients will be paying rates that are well below market. So the other side in this fight has severe problems. They have a fragile coalition that could fall apart without conservatives doing anything.
Yeah. Now, one of the terms the liberals throw around is what they regard as a worthy goal is single-payer insurance. What does that mean?
Single-payer means Canada. It means government pays all the health care bills. The single-payer in their mind is government. And it means there is no competitive insurance. In Britain, if you don't like what's happening in the National Health Service, if you're being denied care, you can go to the private marketplace and buy your own. In Canada, you cannot.
There was a time when Mitt Romney, following his tenure as governor of Massachusetts, was bragging about his role in creating a medical plan in Massachusetts, but it came under some criticism and he stopped the bragging. Tell us about it. What did you think of the Massachusetts plan?
Well, I think it's a mistake, and they have reduced the number of uninsured, but they've done that by putting lots of people into Medicaid and by putting people into private plans that pay Medicaid rates. And so now they have rationing problems. And a study just last week found that the waiting times in Boston to see doctors are twice as long as in any other city. And for Massachusetts as a whole, the number of people going to emergency rooms for non-emergency care is just as high today as it was 3 years ago when this started.
So this is not something about which Mitt Romney is likely to brag when he seeks the presidency again.
He'll be more cautious, I think.
I'm sure he will be. How many states have developed some form of government-guided health insurance?
Well, there is nothing like a single-payer health insurance at the state level. Lots of states have mucked up their market for insurance. But despite the strong interest in this, we've never done it at the state level. I have argued that that it's easy to set up a socialist healthcare system if you want one just for you and your coworkers. General Motors and the United Auto Workers could have a Canadian healthcare system. They could ration care to their members. They don't seem to want to do that.
One of the things which will become an issue is whether, under the Obama plan, taxpayers will be required to subsidize abortions, various forms of contraception, sex change operations, whatever. Has this been discussed among the proponents and critics?
Well, that I don't know, because so much of the discussions are behind closed doors, and the key Democrats in Congress don't want the public to know what they're talking about. But, of course, it would not surprise me. I mean, Obama's a strong advocate of abortion rights, and so it wouldn't surprise me at all if that were part of the health care plan.
Now, if people want to become more knowledgeable about what's going on in this health insurance or health care debate, what's the best way for them to become more knowledgeable? What ought they be reading? Is it enough to read the New York Times or a magazine or whatever?
First, they should go to freeourhealthcarenow.com and sign the petition.
Right.
Then you get a link.
That's your organization.
Yes, yes. But then you will get a link to some positive ideas on how we think the healthcare system could be improved, promoting patient power and free enterprise. Then you can go to ncpa.org, where my blog is really the only right-of-center healthcare blog out there, I'm sorry to say. And it's about the only place where pro-free enterprise ideas on healthcare are routinely vetted, and it's not just conservatives. We get liberals arguing back and forth. It's a really interesting blog.
We're going to have to take a break. When we come back after these messages, Dr. John Goodman will share some important thoughts with you about how we can kill the Obama scheme to socialize, nationalize medical care in America. Stay with us.
Hi, I'm United States Representative Thaddeus McCotter from Michigan's 11th Congressional District. As we enter a new millennium of hope and peril, with so many problems besetting our country and yet so many opportunities before us, it is oftentimes tempting to think that your voice doesn't matter. What can one person do to make a difference in the life of their community and their country? Well, the first thing you can do is to contact your legislator. You are one of the sovereign citizens of the United States. You elect your servants to work for you in Congress. Let them know what you think. Send them a letter, send them an email, call them on the phone. Your voice matters, because if you don't raise your voice in the interest of our free republic, who will?
I want to say and encourage people to watch Howard Phillips and the Conservative Roundtable. I have great respect for Howard Phillips, and I know he is a man that speaks the truth. He's worth watching.
Welcome back. I'm Howard Phillips, chairman of the Conservative Caucus, which sponsors Conservative Roundtable. If you are interested in the kinds of issues we discuss on Conservative Roundtable, please check out our website, www.conservativeusa.org, and send us contact information. You can fax it to me at 703-281-4108, or you can snail mail me at 450 Maple Avenue East, Vienna, Virginia, 22180, No cost or obligation. We'll send you some of our literature. You'll learn more. Why don't you repeat how people can get in touch with you and your organization?
They can get in touch with me at ncpa.org, and be sure to go to freeourhealthcaresystemnow.com and sign the petition.
Tell us about the Coburn bill.
Well, it's a very good bill, and Senator Coburn believes in restoring the doctor-patient relationship.
And he himself is a doctor.
He is a doctor. He doesn't
badly treated by his colleagues because he wanted to continue his practice, and they didn't want him to.
Yes, yes. You're absolutely right. But he's great. If we had more people in the Senate like Senator Coburn, it would be a different world. His bill promotes free enterprise in health care. It would empower patients. Patients would control more of their own health care dollars. We'd have more of a market. Doctors would compete on price and quality the way other professionals do. And so I helped him with this bill, and I think it's a good bill. And it is called in many places the Republican bill because it's been endorsed by Ryan and Nunes over in the House. But I think the majority of Republicans will not get behind it.
Why?
Because they're timid and they don't really want to reform the health care system. And whenever we give them a good idea, they call up the insurance companies and the hospitals, and all those people say, no, we don't like that. And the special interests are the last people to get behind good reform. You don't want to pick up the phone and ask them what they think about this.
It's amazing. Well, we have really appreciated your being with us on the program, and we appreciate very much all the work NCPA is doing and that you are doing as its leader. And you can count on the Conservative Caucus to assist in whatever ways you consider appropriate. We were very active fighting Jimmy Carter in the 70s with his socialized medicine schemes, and we were involved in the fight against Hillary Care. Keep up the good work. Thanks for being with us.
Thank you.
And thank you for joining us on Conservative Roundtable.